The mission trip I attended was in the city of Roatan in Honduras.
I traveled to the Dominican Republic.
We went to like a isolated village in Haiti.
I went to Guatemala twice and Jamaica once.
So the primary focus was on palliative care, relieving them of pain and infection. So we removed a lot of teeth and provided hygiene kits that Dental Associates was generous to donate.
We did cleanings for people that wanted cleanings, and we did a lot of fillings for people.
Everything from cleanings, extractions, fillings, checkups, and also very importantly, health education.
What we did was teach them how to use a toothbrush, tell them to brush 2 times a day for 2 minutes. In Guatemala, the kiddos that we were treating actually did not have a dentist in town, and so we go there once a year, and we were actually the people providing care for them once a year, and it was that was eye-opening. Access to care kind of is something that you really can't take for granted.
We went to like a isolated village in Haiti. It wasn't in the capital. It was way out, like 2 hours west of the capital. So it's hard to get to by car. It's not easy. So these people have absolutely no access to care, so they were just appreciative to have someone look at them and take care of them, and kind of just, even if it's a short-term basis, they're really appreciative of that.
At first it was a little overwhelming just because the country had a lot more people than I expected, and a lot of people that visited our site.
Our clinic was set up outside, and there was a large structure where the inside were the medical students and the nursing students, and there was kind of an outdoor awning that was almost like a pavilion that you would find at a park here, and the dental chairs were outside underneath the pavilion, and we had one portable dental unit that you could actually tip back and do fillings in, and then we had a couple of rocking chairs where we would either do cleanings or extractions.
Just the experience in general of working with underprivileged people and providing them with care and relief that they would not have received elsewhere was definitely fulfilling for me.
It's amazing what you can do with like 2-3 instruments. It just kind of reels you into reality when you come in and you have a beautiful clinic and you've got all these great instruments, and it just kind of puts things in perspective for me.
Most of the people that we saw were really grateful and excited to come see us because, like I said, they didn't have access to dentists or dental clinics.
It was very surprising, but also humbling to see that so many people walked so many miles to wait in line for so many hours just to receive treatment.
The reaction was very grateful. You get a lot of thank yous and hugs, and they understand that you've taken time and you've traveled to come help, and that's special for sure.
Before I went on this trip, I thought it would be easy to go in and take care of people's teeth and help them learn a little bit. After the trip, I realized how little access there is in certain areas of the world, and also the patient education. So you can't just drop in and fix their problems and expect everything to be better. It's really a lifelong commitment.
I love the mission trip thing because it was part of why I went into dentistry. Whether it's care that I provided abroad or care that I provided here, I do it for the same reasons. I do it because I always wanted to help people and measure my success with the number of people I helped.